welcome James Goddard as our last speaker, and after he shares, we're again going to have some time for table conversation and another Q&A. So again, on the yellow sheet on your table, if you want to read a little bit more of a bio, you got to share it. There's one piece of paper, not cutting down so many trees. But let me just introduce you to James a bit. James Goddard is the Economic Justice and Healthcare Access Program Director for Nebraska Appleseed. He's been with Appleseed through his internship, progressing through various stages to arrive at his current role. In the meantime, he earned his JD from the Nebraska College of Law and his bachelor's in social work and from Union College in Lincoln. He also has experience in the Mexico Appleseed Center in Mexico City, Mexico. During his time at Appleseed, he has litigated cases and engaged in policy, advocacy, and media work. Let us welcome James Goddard.
Good morning, everyone. I'm really happy to see such a great turnout this morning. I'm happy to be with you. Again, my name is James Goddard. I'm the Director of the Economic Justice and Healthcare Access Programs at Nebraska Appleseed. I know some folks in the room are familiar with Appleseed, but we are a nonprofit legal advocacy organization, and our mission is to fight for justice and opportunity for all Nebraskans. Can you hear me?
Not really.
I can speak louder.
No, just move it out.
Okay, there we go.
Yeah.
Is that better?
Yes.
Okay. So, as I said, some of you are familiar with Appleseed, others may not be, but we are a legal advocacy law firm, and we take a systemic approach to complex issues like healthcare, child welfare, immigration, and anti-poverty work. And what I want to talk with you today a bit about is ways we can make our families and our workforce a bit more stable. I have passed out a report that we issued about a week and a half ago. I think there's one on everyone's table. You don't need to look at it unless you want to, but it's going to give you some additional detail on some of what I'm talking about.
Is it on the website, please?
It is also on our website, and there are a couple. We have some extra copies over here as well if you're interested in digging into it. It's a lot of data, so not everybody loves that, but it definitely tells a story. So the first thing that I want to talk about is the fact that families are the backbone of our state and our workforce, and we have to make sure that families are stable and strong to make sure our community is strong. That's not any news to you, but unfortunately what we're seeing are a lot of families in our state struggling. You can see here almost 1 in 3 working families are low income. We're not talking about folks that might not be employed or might have a disability. We're talking about working families. Are low income, and by low income I mean below 200% of the federal poverty level. You can see in Douglas County about 15% of folks are below the poverty line. So those are some alarming things to think about. The good news is there are a lot of actions that we can take both as individuals, as communities, at our legislature, and in other ways to make sure that folks have earn enough to get by, they have the support that they need, and have access to health care so that they can make sure they're healthy. There are 3 main areas that I want to discuss with you today: economic opportunity, making sure we have a healthy workforce, and economically stable families. So you can see here, we have a lot of folks that are working in our state. I don't think that's a surprise to people in Nebraska. Nebraskans work hard. We have a strong work ethic. We have statewide 3.9%. Douglas County is a bit higher, but you compare that to the national average, and it looks like we're doing pretty well with employment. But the problem is thousands of folks are working in low-wage jobs. And so they're working hard, but they're having trouble getting by. You can see we have about 77,000 folks have more than one job. That may be 3 jobs. So a lot of people working more than one job to try and get by. We also have about 32,000 folks that are earning the minimum wage. That's $7.25 currently. So we have to figure out ways to ensure that hard work pays in our state. as many of you probably heard, Initiative 425 passed the other day. It is, a very significant thing for working families in our state. The fact that it came through a ballot initiative is also really exciting. I can't think of another progressive initiative that has gone through in this way, and I think it received something like 60% of the vote. So it was resoundingly accepted by people in Nebraska, because I think at some level you just get that $7.25 an hour is not enough. And so this is something to celebrate. It will progressively raise the wage, eventually up to $9 an hour by 2016. So I think this will go a long way to combat poverty, but there's still more work to be done. It's not a silver bullet. Even just thinking about the minimum wage itself, the change does not include servers or waiters and waitresses, and the tipped minimum wage is a big issue. You can see here the poverty rate for servers is 3 times the average for all workers. So when people are relying on tips, we need to make sure there is, in addition to that, a minimum. So I think there may be an opportunity in the legislature even this year for a piece of legislation to raise the tip minimum wage. Not sure if that's going to happen, but I kind of think if you see the voters do what they just did, there's a pretty good argument to say we need to balance this out for everybody. So something to celebrate, but also more work to be done there.
And the tip minimum wage is $2 and something?
That's right, and there was a proposal from Senator Lathrop this session to, I think, make the tipped wage 75% of the minimum wage. So that would be a fairly dramatic increase in your minimum wage for servers. And I haven't heard for sure who is going to introduce a piece of legislation, but I would be surprised if you see 60% of voters saying yes, that there isn't a pretty good argument within the legislature to say let's balance this out. So the second area I want to talk about is making sure we have a healthy workforce. Our economy depends on people being healthy, and for a lot of folks to be healthy, you have to have access to basic health care. Now, the world of health care, unless you've been living under a rock the last couple of years, has really changed. The Affordable Care Act was passed a few years ago, and it went into full effect this year. And what that resulted in was a little over 42,000 Nebraskans enrolling in coverage, many of them for the first time. Many of those folks are enrolling through what's called the healthcare marketplace. You probably heard about some of the problems with that system about a year ago, but what I understand is it's improved. It improved an awful lot as time went on in open enrollment, and it's a lot better now. The next open enrollment period actually starts next week, a week from today, November 15th. So there will be another opportunity for folks that don't have coverage to be able to enroll. But unfortunately, there are thousands of individuals that are not going to get helped through the marketplace. These are people who fall into what many call the coverage gap. And I don't know how familiar people are with this, but it's something I always like to kind of walk through slowly because it defies reason, and that's because it was not created to be this way. So under the Affordable Care Act, people with higher incomes, 100% to 400% of poverty, can go into the healthcare marketplace and they can get help to pay for the cost of insurance. It's called tax subsidies. So they can go in and it's like going onto a website, you want to buy a plane ticket, and you start off with $100 credit right away, and then you buy the product. It's the same thing in the marketplace. Then you have folks that are on traditional Medicaid, but there's a group of people that are left in between that are not eligible for subsidies and they're not eligible for traditional Medicaid. This is what we call the coverage gap, and that's not by design. It's the result of the Supreme Court decision that looked at the constitutionality of the Affordable Care Act, and what they said is there's this one coverage area that you can't force states to do, states have to decide. Nebraska thus far has not decided to do that. So this is the way, this may be a little easier to understand what I mean. You've got some people that are currently eligible for Medicaid, you've got other people that can go into the health insurance marketplace, and then you have around 54,000 or so people that are in the middle. these are the lowest income individuals. So the people that have the least ability to actually afford coverage. And, as I look at this, that doesn't make sense. If you're going to reform our healthcare system, one element of it, in my estimation, is making sure everybody is on the bus. Everybody has coverage and a way to see someone. And when you leave out a big chunk of people, these folks they're going to continue to access healthcare through bad means like emergency room use, or they're going to wait until they're really sick and then go seek care, and it's going to cost a lot more and maybe endanger their life. So one thing we can do is make healthcare make sense and close this coverage gap. It would help ensure a healthier workforce by allowing folks to get preventative care, getting treatment for chronic diseases. There are at least 54,000 people in our state that are going to not have an avenue to coverage without this. One estimate is that it would save around 500 lives per year just in Nebraska. And it would bring billions of dollars back into our state that we're not otherwise going to get. I don't want to spend too much time on this last element, but it's something a lot of people I don't think realize. The way the Affordable Care Act was structured is there were a lot of tax changes and offsets put into place to pay for it. And so their tax dollars are coming out of all of our pockets to pay for these folks on Medicaid. But we only pull those dollars back into our state if we close the coverage gap and take this up. So by not doing it, it's not as if we're saving any money. That money is coming out of our pockets. It's just going to Iowa and Arkansas and Colorado and the other states that have expanded coverage. So it's the right thing to do for people. It's also the right thing to do fiscally to bring these dollars back and invest them in our state and our communities. The last area I want to talk about are economically stable families. Too often, because of low wages and other factors, folks just can't afford the basic building blocks of what they need to get by. And when that happens, you have people that end up turning to public assistance programs because often they don't really have a choice. You can see here we have nearly 70,000 folks in our state that are low income, and 30,000 people that spend more than 1/3 of what they get every month on housing. Mm-hmm. When you're in that position, you're, in my estimation, forced to look to public assistance programs, and I'm going to talk about a couple of those to try and get by. One of those is the Child Care Subsidy Program. I'm not sure how familiar people are with this program, but essentially it is a way for low-income folks to be able to get help paying for the cost of child care so that they can look for work, go to school, or get a job. So it's really important to allow people to actually, find a job or maintain employment, to give them some help paying for the cost of child care, because child care is extremely expensive. So this is a program to help some individuals defray the cost of that. The eligibility limit is about 130% of poverty. That's about $2,000 a month for a family of 3. So eligibility is fairly low. That's not an awful lot of money every month. The other program that I want to talk about briefly is probably one people are more familiar with, the Supplemental Nutrition Assistance SNAP or food stamp program. It's a program to help folks buy nutritious food. It's no longer a stamp, as you probably know. It's an EBT card. It's like a credit card. You use it the same way in places that accept it. And the income limit for that program is also 130%. So again, about $2,000 a month. Unfortunately, the way the state has structured eligibility for these programs can actually undermine people working or getting a new job or getting a raise. I think Ms. Mancuso may have discussed this a little bit earlier, but this is something we refer to as the cliff effect, where a modest increase in your income or a new job will mean you lose this support. So you can have a 25-cent increase in your hourly wage, that can mean you lose both your child care assistance and SNAP. But that 25 cents doesn't equal out to the child care you had or the food assistance you had. So you have people that are working hard, they're trying to get ahead, they get a new job, they get a raise, and they fall off this eligibility cliff, and they take one step forward, two steps back. This is a choice that the state can make. The program doesn't have to be designed this way. And so what we would suggest is, reward work and address the cliff effect. You can do this in a couple of ways, but essentially the concept is to make it a more transitional program, where maybe you walk in the door at a limit of $2,000 per month, but once you're through the door, let's bump that up to $3,000 per month if you get a raise or you get a new job, so that you're incentivizing work and not having people fall off the cliff. Similarly with SNAP, you can raise the gross income threshold and have more people getting through who have increased their earnings over time. So it's something that I think is resonating a bit more in our legislature than it has in the past. And that's what I guess I want to emphasize about the three areas I just talked about: the minimum wage, closing the coverage gap, addressing the cliff effect. These are all policy decisions that can be made by our state legislators. Some of these can even be made by the executive branch through the Department of Health and Human Services. But they are things that can be changed. They're not set. They're choices that we make as a state. And so these things are things Appleseed is advocating for to change and improve, and things that all of you can be a part of in trying to improve these programs. And so that's really what I want to end on, are some of the things that you can do. One thing is to stay on top of what's happening. I believe there will be legislation this year on possibly everything I just described. I think there will be minimum wage, I think there will be a Medicaid bill, and I think there will be a bill around SNAP and child care. So if you're interested in these things, you can stay engaged, you can sign up for our email alerts. We'll tell you what bills are out there, what we're looking at, when they hit the floor, when the hearing is, when you can actually be engaged in the process. Another thing you can do is volunteer. We're always looking for volunteers to help in different ways. Some of those are just organizing yourselves to go out and talk about these issues. Some of it is a phone bank. Has anyone ever done a phone bank? You know what I'm talking about? Some folks. It's basically where we get a bunch of computers and a bunch of phones, and we have lists of people to call, and you call someone and say, hey, I'm calling on behalf of whatever group you're with, and we're seeing if you'd like to support a change to the minimum wage. Would you like to do that? They say yes. You press a button, and they're automatically transferred to their senator. It's very easy, and I think very effective. The other thing you can always do is to write or call your senator. And I'm of the mind that this makes a big difference. I think sometimes folks think they're not going to listen to me, why would they care? But if you're their constituent, if they get 5-6 calls from a constituent about something, that's meaningful to them. And so never underestimate the power of contacting your representative. The other way is to engage with the media in a public way. Writing a letter to the editor or an op-ed it's a very easy way to express your opinion. And I can tell you, senators' offices read these. I don't know if you do. I kind of wonder if regular people actually say, I'm going to read the letter to the editor column, but policymakers do. And so I think it makes a difference. And the last thing I would say is sharing stories. This is constantly what we hear, is the need to... I shared a lot of data with you, but these are people we're talking about. These are individuals. And we always need that individual who has that story to say, hey, I fall in the coverage gap. I need health care. I can't get it. And having that person talk to their legislator, talk to a reporter, that is extremely powerful, and it's something that we're always trying to find and keep our eyes out for. And for some of these issues, these probably are people that you know, because these issues affect so many people. So, as I said, these are the ways you can get involved, and I believe you will see several bills over the next few months where you could actually engage on one thing or another. So, that's what I have.
Thanks, James. Now we're going to have about 15 minutes of small table conversation. And again, each table has a facilitator. The question that you're going to chew on a bit, and you brought paper, this is, you haven't been writing. This might be the time that you really start thinking concretely about what you might take away for either your church group or organization that you represent. And the question is, what might you take back and explore with your faith community or group? What might you take back? And specificity at this point is a helpful thing. It doesn't help me if I just say, well, I'm just going to make more people aware of all this at my church. So we've been inundated with lots of good information. So this is your chance to just kind of hear from others and hear yourself speak about what you might be able to take back to your community or group. To James. So raise your hand and the microphone will find you.
Who has a question?
Marie?
This, you might not know the answer to this off the top of your head, but I get the impression that you do. So I thought that I had heard that at the beginning the Medicaid expansion would be covered for Nebraska. Nebraska would have to pay for that, and then over time Nebraska has to pay for more of that. And so I've been told that Nebraska doesn't believe that it can actually afford to expand Medicaid. Do you think that Nebraska can afford to expand Medicaid?
Absolutely. You're right. So the first 3 years is 100% federally funded, and then that tapers down over time to 90%, but never less than 90%. So the federal government will foot the bill for 90% of this program in perpetuity. I think I'm trying to remember what the fiscal note said. That it's not as if the state, of course, then has a percentage it has to pay. It has to pick up that 10%. But when you take Medicaid up, you also don't have to pay for other things that we're currently paying for. There's savings in corrections. There's savings in behavioral health. There's savings to counties and general assistance. There are all kinds of ways where this ultimately balances out. And in the first couple of years, there's actually savings to the general fund in the first three years of it. Beyond that, it are $2.3 billion over 10 years that is not coming back to our state, not coming back to our economy. That is our money. Those dollars are tax dollars that are coming out of our pockets, and people may not like that that's true, but it is. And so, in my estimation, we can't afford not to do this, to bring the dollars back, as well as, the right thing in covering 54,000 people that otherwise will not be able to get the coverage.
So what could we do?
Right.
What do you suggest that we do in order to make that happen in this state, Medicaid expansion?
Well, I think it's some of the points on the slide that I put up there. We always need folks who are engaged. There are times to do phone banks. There are times for you to just pick up the phone and call your senator. There are times to try and find those folks in your community who actually fall in this gap. And if you're interested in staying in the loop on when those volunteer opportunities arise, I can facilitate that. We have a new field director and a growing field capacity at Appleseed for this work. So I think part of it, is sign up for our alerts. You're going to see when a bill's introduced. You're going to see when there's a hearing. You're going to see when there's a chance to engage. And we can stay connected through our field work to say, now's the time, we need volunteers, now's the time to make a phone call.
Talk about bucks. No.
Absolutely.
What happens to those people while we're, say, doing this volunteer work that are just dropped out of Medicaid?
They are, well, you know, some of them are healthy and may not go to the doctor. Some of them may go to the emergency room. Some of them may get sick. Some of them may die. I mean, the statistic is 500 people a year will die. So, you know, it's not something that should, in my opinion, have waited all 2 years at this point. And so you know, it's a mixture of some people will be healthy and fine and other people really will not. So it is, in my mind, the highest priority. Certainly Appleseed's highest priority right now, and should be the top priority for our legislature too, in my opinion.
I would like to add that Omaha Together One Community, known as OTOC, who is partnering with Nebraska Appleseed, has made that a priority as well. We started a new action team in February looking at Medicaid expansion, which now we're kind of renaming that, but we're definitely looking at closing that coverage gap. And so that team is going to be planning strategies of how to deal with proposed legislation. So if you're a member of an OTOC church, you'll be getting more information about that. We'll be having some kind of a public meeting at the Urban Abbey in January to talk more about our strategies to work with that. So again, you know, keep your eyes and ears open, and there will be a number of ways I think that you can particularly support that effort.
We appreciate all those that spoke with us. It's been really helpful.
I've supported the work on trying to raise the minimum wage, which is important, but probably a more serious concern for me is the number of employers, especially retail, restaurants, and these are the jobs most often. If you have any kind of a criminal record, it's the only thing you're going to be able to get. So consider the impact on our communities of color, where we know there's disproportionate minority representation because of our criminal justice system is biased. That these employers very often will not give more than maybe 20, 30 hours at a max every 2 weeks. And then you only get your schedule maybe a week out. So if you're going to try to have enough hours in so you're getting enough money back, you got to have at least a couple of jobs, but it's almost impossible to coordinate because you don't even know when your schedule is going to be. These same employers, by the way, are extracting huge profits, largely because they're able to count on government and other assistance providers to make up some of that gap. I mean, what kind of, and I'm not sure legislative advocacy is going to change that, so what kind of advocacy are you going to engage in to start to change that reality? Because we can keep raising the minimum wage, but if people aren't given hours to work, it's not going to make a difference.
No, I think you're right, and our Immigrants and Communities program does a lot of work on employee rights. Some of what we worked on is a ban the box around felonies, on having to say you had a felony on your application. That actually ended up passing, but it's only for public entities. It doesn't affect the private industries, which is a whole lot of jobs. But I mean, I think how do you the hours issue and the shifting schedules is something we were just reading about the other day, an article about that very thing where you don't know week to week when you're going to be working. How are you supposed to do anything really? Especially have more than one job. I mean, I think. I don't know that is a legislative solution at the start, at least. It almost seems to me more that that's a grassroots movement of organizing people to say, as you've seen some of the fast food workers do in other parts of the state and country, organizing to walk out for a few hours each day and say, this is not right. So, you know, applying some amount of pressure on the industry through its workers versus, I'm not sure if there is a legal hook. It's not something I know as much about, but it seems to me it is a grassroots organizing strategy is the way you try to get to that. But it's certainly it's a heavy lift, but that doesn't mean it shouldn't be done.
Did I understand that part about, were you also talking about people that have felonies that can't get a job even though they've been rehabilitated and out in the community
where when they apply for a job, you get all the way to the end, then they say that you have a felony, and then they say, sorry, we can't hire you.
Sometimes it's even before that, where they ask you on the application whether you had a felony, and if you say yes, your application goes in garbage. So there has been some work to say, to disallow the requirement to have that box on there, and then you can't, I don't think you can ultimately get around an employer being able to say, do you have a felony? Sometimes that's, if you work at a bank and you have an embezzlement conviction, that's relevant to your work, so.
It's not just felony that's misdemeanor. Well, it's that misdemeanor that's tax related, that's what I apply. And more employers are actually using credit score reports to weed applicants out.
And there have been some laws, I think, around that to prevent that. I think there was even one introduced this year to prevent discrimination based on your credit score. I can't remember if it passed. But there are some legal ways
Not
to get
many
it done.
jobs left, if everything says, you have a felony, you can't be hired. You know, even though it's been 6 or 7 years since that, and you have a good track record, they still couldn't get hired.
It's an enormous problem. I mean, you're punished, you've done your time, and you come out and you're supposed to come out. I mean, how are you supposed to work?
Yeah, my comment, I want to come back to your question because recently in the media was the case of Starbucks. Starbucks was notorious for doing exactly what you said. And in their case, what caused a policy change at the highest level was really the media, that it hit the media and the reaction of the people and the pressure that put on the CEO. I don't know how much a grassroots effort would change that. And part of the problem is many of the people impacted with those issues have issues with immigration and others, and they don't want to create waves, and that's how employers get away with a lot of that. So, I would say as we become aware of that is, a call for the Omaha World Herald or something, or use tweet, do a Twitter, and tweet something out or put it on Facebook. And the last thing CEOs want is that bad publicity. So again, I look at the model of what happened with Starbucks. And then coming back to the issue of background checks and all that, it's true what you're saying. Now it's not till basically you're gonna get the offer or you get the verbal offer of employment that background checks are done. But many employers will still hire unless it's something that specifically is going to impact the job you're doing. Many won't, but many will. So it's not like all employers just say, okay, you've had a misdemeanor or a felony, we won't hire you. And I know I've worked with a number of employers that are very, very lenient in that area. But I think there's a lot we can do in that area, whether it's by our own employment or by using our voice to help make a difference.
Who else?
I have an idea for next year's event, if it's still going to be on. Talking about making a change in contacting your senator. Maybe after this meeting, write a letter to your senator, and then the next year during this meeting, maybe we should have ways to get in contact with our senator so we feel that we can make a change immediately. That's just a little feedback that I have.
Have you ever done an advocacy training? Like how do you write a letter? Like how do you craft your story? What are the key points to hit on? It's certainly something we do with various groups. So.
Any other comments or questions for James? Okay, let's express our appreciation. Thank you, James. And thank you for bringing that up. We're going to give all of you an opportunity shortly, you don't know quite how shortly, but there's going to be an online survey for you to let us know. I have two simple questions. What was helpful to you today, and what might we improve if we decide to do a similar gathering next year? So we need your input, and that will be coming to you because I think we have everybody's email addresses. So we are moving into the time of each table is invited to share briefly some of your conversation. And we want to stay focused on ideas for concrete actions that you might take back to your community group or your church group. And this will be kind of cross-fertilization here. So as you hear some good things, you might be writing those down for yourself as well. So if the facilitator at each table is ready to maybe share, we're talking maybe a minute or so, just to highlight some of the things that you talked about, we will do that. And I think we'll start back at the back table. Ruth Cruz, Warren Mullins, Steve Todd table. Would somebody be willing to share some of your ideas?
Yes. One of our churches is offering 80% health care for the staff of the child care workers and trying to assist them. And they are thinking of creating more incentives with their child care participants, the families. Another idea was to do some consultation on the Medicaid personalities with one person, go through the process and see what the difficulties are. Churches could offer computer assistance for health care insurance. Churches could write letters on Medicaid, as we are advised. Let's see. Bring poor or folks of low income to testify at legislative hearings. Tell stories instead of only giving figures, but tell stories of people that are having difficulties and educate these persons, clients, sometimes we call them, to write letters. Is there anything else? That's pretty well.
All right, thank you. This table.
Well, we were visiting about our church role first. So the Mercy and Justice team, how they help us here at the church to write to our senators. And we talked about the OTAC as well, and that there's Issues Cafe at the Urban Abbey, and they will be talking about things about like the minimum wage and how to help with that. So we felt like we had some things in place here at church that we are already doing.
Our table, one of the things that was mentioned was, don't think you have a choice. Think the only way to go is to move forward for mercy and justice and loving your neighbor as yourself, and seize on that prophetic idea and let that, no choice in doing that. So use that for motivation. And to be more active in whatever ways have been mentioned here, whether it's writing letters, talking to people, working phone banks, whatever. Third, hold employees who are not just accountable. Think about taking a local action or making a local action. I personally boycott Walmart. Unclean, unclean, I say. I don't want to. Communicate the information that we have gotten today, this great information, to friends, to family, to neighbors, and educate them. Because we have gotten wonderful information that, and I'll just add to that, allow people, or say out loud, this is not simple. It is complex, but there are solutions. And people have good ideas, and it can be done.
Okay, our table talked about using the opinion page of the paper, which was made clear that politicians pay attention to that. Let's make sure we contact, we call, we write policymakers. Some felt very strongly that we need to be held accountable also and be smarter in the questions we ask our politicians. We need to be tougher in that area, challenge the role of lobbyists in regards to them as politicians, and ask them really what they're going to do, how they're going to do it, how they're going to deal with lobbyists, and keeping a good level of respect, but challenge them with their questions. Attend political meetings and speak up, engage in grassroots organizations. And we said as a church, we periodically bring politicians here, like we did recently. Be prepared and more strategic in the preparation of our questions when we bring in politicians to inform members and community. But the table felt very strongly that we need to be fair in the way we address politicians, that we need to listen, and that we need to have respect for both sides when we deal with the politicians. We need to be and continue to become more informed. We need to volunteer and get involved to improve the life of others. Stephen Ministries was mentioned, Girls Sing, serve as foster parents, mentor the many kids out there that need mentors. And then that for those of us that are in the workplace and can, we can work to impact job opportunities for all and really focus on disadvantaged individuals that can really use our help.
We have some educators at our table, and we're going to steal, plagiarize, whatever, Robert Bly's paper, and sell it everywhere we can. This person talked about taking it to her husband and to her principal, and using that information in that way, so you might consider such a thing. Also, this person also talked about home visits, parent contact, those. And then there was a concern that maybe we could go away from here with a list of things, resources, etc. So this is our assignment for next time, perhaps. And also the contact with the legislature. I just want to advertise February 14th, Valentine's Day. There is a legislative briefing day in Lincoln. And it got canceled last year because of lack of attendance. And we would hope that that would be something you want to do. And the major speaker at the end is none less than Dr. John McKeel. So you would want to hear that for sure. But there are also workshops that you'd want to go to. We talked about outreach programs in the churches, collecting money for various things, collecting food, etc. And then there was another need for resources that maybe we want to come to too, and that was where can you get free this, that, and everything else, or reduced cost. And there were examples for restaurants and so on. So if we can follow that up, Carol.
Yeah,
Most of that.
I'm with a good group of St. Paul Methodists, and they're all on the mercy and justice, so they will take it back to the church for the mercy and justice. Personally, I would like to contact Ron and question him on his take on the families in poverty that are successful, if we could find them, and how do we do that, and how do we get going on what he said, find out what their success is. Volunteering in schools and the reading programs, possibly have mentoring, getting more involved in mentoring programs in schools. And we need more chatter. We need more of these forums, in our churches, more discussion at our dinner tables with our children. get them active and making more contact with fellow students and how they do that every day. Thank you.
We were a small group at this table, but we represented two congregations, Pacific Hill Lutheran, 90th and Pacific, and First United Methodist, our own church here. But we talked about a few things that we thought could be done, tying on to what Ruth said in that first table, writing letters and so on. One of our members suggested that, I'm willing to, if I participate in Shalom in Action and the letter is written or the postcard is ready to go, I'm willing to send it, but I don't always have the time to take to do that. So a Shalom in Action on a monthly or quarterly basis that can address the various issues would be one. We also talked about the idea of there are many needs in our congregation that we don't necessarily know about. So first of all, relationship building and determining those needs, and then possibly developing a cadre of such persons as nurses, where they could at least help persons navigate the system, or social workers, or persons that need help with Medicaid and Medicare. So having that list of resources where people can go to when the need arises. We talked about mentoring, and mentoring every person that might have those needs through this cadre of persons that we develop. And then finally, the attitudes that we present in terms of energeticness, vivaciousness, interest in, related to particular issues. That's one way that we can perhaps motivate people to move on and to take action. Whereas if we strictly are analytical, we don't necessarily have the impact that's necessary. And one of the examples was that we talk to people that a family has less than $2,000 per month qualifies for certain programs. That makes more sense than talking specifically about 130% of poverty. I mean, we may know that, but if we can get quick facts to them.
Let's see. One of our members of our group mentioned that she is part of a statewide organization, and thinking about political decisions, we maybe don't just need to affect people in this immediate community, but maybe throughout the state. So if you are part of a statewide community, you might be able to contact folks in other parts of the state. And in the same way, if you have friends or relations in other parts of the state, you might be able to advocate not just to your next door neighbor, but maybe to somebody in Kearney that you are related to, because those folks are going to be involved in the legislature as well. Anything else that you could think of? Anything else? We thought of a lot of things, but you've all mentioned them already, so.
Most of ours have already been shared. What we did come up with was education, though, as an overall topic here. I think educating our congregation about what systemic means and the systemic issues that surround poverty, and educate our peer groups and our coworkers with the information that we've learned today, and to share that. I've had a lot of success in pre-printed postcards. If we could have them available when different issues arise, have them already pre-printed, and congregants just have to sign their name and address and send them off. They really do make a difference. And to formulate a petition for annual conference and to work through our churches in relationship to poverty. I think that's pretty much what we have.
Carol, there was a concern over here that the computer doesn't always get to the people that need to hear the message, so we need to be aware of that too.
I think we have one more table.
Well, many of the things that have been mentioned already were on our list. One of the things that we were primarily members of First United Methodist Church here, not all of us, but we talked about the growing diversity within our church and that it's important to continue to nurture that, and that we look at decisions that we make at the church level so that they're more whole community based. And we think it's important that we get to know people who are not necessarily like us. And as an event, and then as an approach to try to schedule some cross-cultural efforts and make cross-cultural events and activities to involve the larger community so that we can better understand those situations. We talked about, again, the educational part of expanding the Rainbow Factory here at First United Methodist by offering scholarships to include more children who maybe in poverty can't afford, and so developing that a little further. And then we heard some discussion about advocacy at our table. Kristen Ostrom is from Bread of the World, and I'm going to upstage her just a little bit. She has two brochures with her. One is called You Can Change History for Hungry People, and the other one, Advocacy 101, which gives some ideas about how to do that. So I know Chris has a bunch of those to pass out. Thank you.
Thank you so much for lots of ideas. As I'm listening, I'm just thinking that sometimes those of us who work so hard, and everybody does in this room, you're passionate, you're compassionate, and you've been working for justice for many years. I know that. That's why you're here. And I guess I'm talking to myself as well as all of you, but I think we need sometimes to stop and affirm what we're already doing. And I heard a lot of good things around the table of things that are already happening. Wednesday was a pretty heavy emotional day for me after the elections, but I kept telling myself, gosh, we worked hard on raising the minimum wage, you know? Wow! So I guess it's just a little pep talk to say the challenges are daunting, but we need to identify the successes, even small successes, and pat ourselves on the back and let that encourage us to keep going. Again, today we hope that it will not only inspire every one of us as individuals to do more, but we hope that you will go back to your church, your organization, and you might identify allies. And, within the next month or 6 weeks or whatever, you might say, I'm having coffee at my house, come on over and maybe get an affinity group. Some of you already have that affinity group, and so we hope that you'll get some ideas today on to strengthen and do more work effectively. But individual work is critical, but we're really, really hoping that you'll go back and you will do some corporate work in your congregation. Would suggest that if you don't already, you might explore with your pastors forming a group in your church that specifically focuses on the systemic and structural causes of poverty. I think that it's kind of tempting sometimes to put all of our focus on direct service, and it's critical. But this is an encouragement maybe to think about getting some allies in your congregation to form a team that will really focus on, as Mary said, these very complex structural issues for the long term. I wanted to acknowledge that we have a few books over here from our church library, and if any of those interest you and you would like to borrow it, Ruth Cruz is our church librarian, and she says that you'll just fill out a card so she can keep track of it. Those books are available there. The other thing, too, and I know you all realize this, but I'm going to say it one more time. Sometimes churches are hesitant getting involved in politics. And I think as many times as we can have a conversation with people, that the church really is called to be involved in politics. Partisan politics? No. But we are called to inform ourselves and be advocates on the issues. So we can sponsor forums in our churches, we can put all sorts of political stuff out there, as long as it is focusing on the issues. And I know you already do that, but some of our church families are hesitant to even take the step because they think separation of church and state, so we just need to be silent. So I know you know that. Two plugs, and James said it already. Maybe you're going to go back to your church and say, in the next 6 months, our goal is going to be to get 10 people in our congregation to sign up for the Appleseed alerts. Or you might go back and say, we're going to get 20 people, maybe focus on a young moms group or whatever, and they're going to be on the Voices for Children advocate alert. We've got many good organizations. Appleseed and Voices, they do so much work for us on our behalf. They do all that research. They're ready to help us. So that would be another goal. We're going to get X number of people in our church to be a part of those alerts. We have a few, I just want to acknowledge that we have Lutheran brothers and sisters here today, Unitarians, our Catholic friends are here, we have individuals from the broader community. Thank you so much for coming. I would like to invite those people who are here representing another dynamic community organization or effort to just stand and introduce yourselves. We have so many resources in this community. So would you start and just say your name and who you're representing? And then we'll just go around the room. If you're representing a community organization.
Hi, I'm John Jeanette. I'm with Heartland Family Service.
Thanks, John. Don't be shy.
Kristen Ostrom, and I'm with Bread for the World, and have been working. I'm the product of a group like this who met in the 1970s. My career, I should say, is the product of that. They said we've got to get young people involved in advocacy as we get the church involved in advocacy. So I've been doing that ever since, and had a chance to work with Voices for Children and the ACLU and some immigration organizations, and now I'm working with the faith community. So I look forward to getting to know some of you.
And is home base Omaha?
Home base is Omaha.
Okay.
Generally a federal focus, but we all know that what happens in DC is because of what's happening here too.
Sure. Thank you so much.
I'm John Mills, active in the Progressive Peace, and also in policy research and innovation. And last night, I was at a meeting that I think you all will enjoy, sponsored by the Black Men United over at UNO. And they are forming coalitions around 4 issues that will be ongoing and working, and they would welcome participation from the congregations involved here. One's poverty, one's education, one's child welfare, and one's police community relations. And I'd be glad to share the information.
Great. Thank you. We've had a reference to Omaha Together One Community. We thank Carol for bringing that up. That's another avenue for action. Other groups represented.
I'm from the Food Bank of the Heartland, and I actually work on the SNAP team, so I help people get applications through, and so James's information is directly related to what I do in raising the poverty line, not to 130, but to 150%, meaning that a household of 4, right now, it's $2,500 around there. That's their monthly income. That's gross monthly income. So not including, they subtract rent and electricity, all those things after they reach that line. So someone who makes only $2,600 a month is still, scrounging around for food for their kids. So raising that poverty line is just one step. So I'm with the SNAP team at the food bank department.
Other folks representing organizations. Yes.
My name is April Thomas. I'm a nurse practitioner at the Renaissance Clinic. We're a clinic for the uninsured of the Salvation Army. So people don't know very much about us. It's $25 copay for lab work and full physical exam. It's cheap as dirt. So if there's anyone you know who doesn't have insurance and needs that, we're at
Anybody else? We got Methodist Ministries represented here.
I'm Deb Keeney with the United Methodist Ministries and Clinton Community Gardens. We have over 100 that we've started, and we have 40 in East Omaha, and they're to build community within the community and to have fresh fruits and vegetables for those that haven't had access to.
Okay, anybody else? Before we close, I asked Jane Florence, our senior pastor, to close us and send us forth with prayer. But again, just to say thank you so much. This is the first kind of event that our little team has helped to plan. Tim.
Is this information available someplace? The handouts? Like
Jane said the Appleseeds information is on their website, right? And I'm sure you can, the legislative advocacy day thing, hopefully everybody got that, but you can go to Interchurch Ministries of Nebraska for that. Tell me what else you're referencing, Tim. Bread for the World?
No,
the Bly thing?
The Robert Bly information.
There's a
okay.
corporate guide on the first page.
Thank you for that. I think if we do this next year, we're already learning about, we'll have a list of resources. But any comments or words of wisdom that anybody wants to share before we thank you, Mary. We have a health ministries team here at United Methodist Church, and they provided with other volunteers our healthy snacks. So we want to thank them as well. Thank Bob Myers for doing some little videoing for us. Thank you. And Mary Spurgeon and Jane and others who have helped with technology. I always break out in a rash thinking about technology, so thank you very much. I thought it went very smoothly. And thanks for kitchen crew and greeters. A lot of volunteers went into making this morning a success, so thank you. And especially those of you who came and gave your day. We hope that you will go out feeling encouraged and a bit more informed and of good cheer. God loves us, and God promises an abundant life, and we get to be a part of that with our spheres of influence. So thank you for coming, and Jane, if you would send us forward. And while she's coming up, if you would help us by taking your dishes. There's 3 great tubs. You just plop them all in there, and your napkin volunteers as we do kitchen cleanup. Thank you.
Once more, I would thank our team that worked so hard to put this together. And so, thank you all so much. I would invite you to rise as you are able and comfortable in doing so. Eyes wide open or shut tight, hands together or down, however you feel most led to be in community at this time. God of grace, God of mercy, God of justice and abundance, we give thanks for your spirit of compassion that resides in the hearts of each one that is here. We give thanks for your spirit that calls us forward to do justice and to love kindness and to walk humbly with you. We ask blessings on each one gathered here this day and on their work as they go forward to share your love in the community and in the world in so many ways. We are blessed. Amen.